So hi everyone, my name is Francis Miss Yap, your second year student nurse from Davao Doctors College. And today I am going to perform the female urinary catheterization. So urinary catheterization is a process in which the catheter is inserted to the bladder to collect or drain the urine. So first things first is to do the check the physician's order for the catheterization, and of course introduce yourself to the client and verify the client's identity using the two identifiers. Establish good rapport to the client, and of course provide the client the opportunity to ask or raise for his or her concerns. Ask how the client and how she would like to be called. Then of course apply gloves as necessary, and do hand washing to prevent the spread of the microorganisms. So now, put the equipment to the tray ahead of time will prevent the contamination, such as first is the set of or the tray of the catheter, which includes the sterile gloves or the clean gloves, the urinary bag and the catheter, of course the 10 cc syringe, the plaster, and of course we have the sterile water, the antiseptic, the lubricant, the draw sheet, and of course the forceps. Will save us time and energy. So now put the patient at ease and explain the procedure to the client. Of course, on how she can participate during the procedure. Ensure the client's comfort and privacy by screening or closing the room. Then position the client into a dorsal position with these flex to have a good visualization of the meatus that is essential for introduction of the catheter, and the gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. So hi ma'am, hello, my name is Franz, your attending nurse for today. So may I know your name?
My name is Mary.
Okay, so when is your birthday?
November 27.
Okay, so is that okay that I'm going to check for your wristband?
Yes.
Okay, what do you want me to call you ma'am?
Anything you want?
Okay, so Mary, the procedure that I will be doing is that I am going to perform the procedure of the urinary catheterization. So this order is based on the physician's order. So this will help you to relieve your acute urinary retention. So of course, I will be touching some parts of your body. Is that okay with you?
Yes.
So as you can see, the curtain is closed so that there will be no other people who can see us, and of course, to provide you a privacy. So do you have any clarifications or concerns?
None so far.
Okay, so we will going to start the procedure, ma'am, huh?
Okay.
So now let's drape the patient, exposing only the area used. For the reason that is embarrassment and chillness, we can cause the patient to become tense. So tension can interfere with easy introduction of the catheter and direct light for visualization of genital use. So now, let's going to drape the patient. So the second step is open the tray and arrange the equipment for the convenience and accordingly to avoid the contamination of sterile item. This is done for us to increase the speed of the performance. Now use the sterile forceps to cleanse the area using the cotton ball with betadine. This is done because the thorough cleansing of the meatus and the area surroundings, it reduces the possible introduction of the microorganisms into the bladder and open the set. Put on the gloves to prevent the spread of ourselves to the client, and of course, put on the eye sheet. So now, after cleaning the genital area, I am going to change my gloves because my gloves is already contaminated. So now let's lubricate the catheter about 1.5 inches, being careful not to plug the eye of the catheter. The purpose of the lubricant is to reduce the friction. So now, pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb of one finger of the left or right hand between the labia minora. Then, separate and pull up gently because separating the area immediately surrounding the meatus helps make it visible. So now, let's insert the catheter into the meatus for about 2 to 3 inches until the urine begins to flow. So female urethra is approximately 1.5 or 2.5 inches. So now, if the specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container position because urine will flow out of the catheter if lumen is not occluded. So now, rest the hand into the pubis area while holding the catheter in the place to prevent the pulling and pushing of the catheter. Withdrawing the catheter and pushing it back into the urethra increase the possibility of contamination to the urethra. Then afterwards, connect the catheter to the urine bag. So now let's inflate the balloon 10 to 15 cc sterile water using 15 to 20 cc syringe. Then secure the indwelling catheter by tapping it to the patient's thigh. And allow some slack of the tubing to accommodate the patient's movement. So now let's do the aftercare. So of course, afterwards, we need to place the patient comfortably and clean all the equipments thoroughly immediately after use because secretions, lubricants, and other substances are removed more easily when they are not coagulated. Mama, paano na yung babae mo? Paano na? So now, patient M is 51-year-old female, was performed a catheterization. So the time started at 9 a.m. ended at 9:45 a.m. So the color of her urine is clear.